Good afternoon and welcome. All protocols observed. Today we are gathered virtually to highlight issues affecting Caribbean families during events such as pandemics and to hopefully sway each of you into joining the children's cause. Indeed, these families are severely affected during pandemics and suffer in silence as it is unknown to those that can help. These issues then trickle down to their children and can affect them academically, mentally, socially, emotionally, and even physically. As such, the issues highlighted today are worth taking a look at. Let's get right into our overview so that we can see exactly how Caribbean families are impacted during pandemics.
Vulnerability is defined as the traits of an individual or group and the circumstances that influence their capacity to predict, cope with, resist, and recover from the effects of a natural hazard in the context of disaster risk reduction. The idea is flexible and relative, and frequently has a close connection to poverty and is further classified through three main sections. Human vulnerability, which combines the last two elements, physical susceptibility to the environment, and social vulnerability, which impacts the population's societal, economic, and administrative institutions. The prevailing idea is that anytime a vulnerable group is exposed to a risk of any kind, a real tragedy happens.
And you may ask the question, who are most at risk? The Central Statistics Office declares or denotes that among the most vulnerable in the region are women, children, the youth, the persons with disability. Because Caribbean economies are faced with common challenges daily, these nations have numerous challenges that often make them susceptible to negative impacts of disaster, as these countries are typically grappling or they grapple with high amount of domestic and external debts. They face frequent disparate population, fragile natural habitats. They have a reliance on imported energy, significant sensitivity to climate change and natural disaster, and a high prevalence of diet-related illnesses, thus making the region vulnerable in all three sectors mentioned earlier. Of course, the COVID-19 pandemic has exposed the vulnerabilities of Caribbean economy even more. According to a new regional lab reports by the International Labour Organization, ILO, the Caribbean region has a rate of 96% of employees unemployed and a further one-half of the population with irregular employment. As such, the entry warns that the region must prepare for the possibility that the employment crisis will continue to rise. This is separate agencies such as Disaster Management Unit in Trinidad and Tobago, or the Office of Disaster Preparedness and Emergency Management in Jamaica. There are also joint regional agencies such as the Caribbean Public Health Agency and the Caribbean Disaster Emergency Management Agency that distributes some form of relief to vulnerable Caribbean families. As such, because these entities often act separate or single in focus, their reach is limited, and many families are in dire need and are often missed, and their children are made susceptible to being neglected, left out, with strangers, or even being exposed to sexual abuse. They are also used as prostitutes in the ring of prostitution. They are being involved in child labor as parents cannot meet their basic needs, and safety needs are also at risk. They cannot afford the cost of basic items needed for their daily living and are not able to provide economically, just to name a few. Even so, there are far too often in our economies or communities that are sure we with each can share, or we can state when vulnerable families are missed out in such assistance that they require those assistance to survive, but because they are not given the assistance that they need, they are at a greater risk. Research has even shown that the effects of the lockdown, and we know of the lockdown during the pandemic, and other measures that was taken to address health crisis was disappropriately done. And so it was felt by many families or many groups of individuals who were already marginalized before the pandemic. And so as the pandemic and they were marginalized, they were placed in a deeper vulnerable state. And as such, we had migrating families, persons having to move from their country, from their home, just to survive. Families of lower income really felt it during the pandemic. And so families and other persons with disabilities who had children with disabilities felt those challenges during the pandemic. Thus, the general consensus is that the pandemic made societal fault lines more apparent and in many cases deepened them.
What is the impact of an advocacy group, you may ask? An advocacy group is one that represents the agreement of an entire body. Grella stated it perfectly. Advocacy campaigns are the driving force of progress. The combined efforts supporting the issue at hand tends to get a more impactful outcome than one voice. Persons who are passionate and support the issue at hand work tirelessly on behalf of all sharing the same thoughts. The impact that these groups create is a great impression to bring about change, or that change is immensely needed. There is a saying that goes, one hand cannot clap, and this proves that when people come together in joint efforts, the results are more likely to happen. Within education, there are a number of advocacy groups that stand up for children, as they are entitled to a voice as well. The impact of advocacy groups prove that change can be influenced by empowerment. As such, there is a need for advocacy groups to share ideas, represent the community, and stimulate change.
Thus, the time has come to engage in joint collaborative work through utilizing our regional counterparts, religious institutions, varying ministries, statistical divisions, and our school systems to gain crucial intel on who are these families and what needs will be made vulnerable in a pandemic, so as to create a vulnerability map to aid persons and regions alike in distributing resources in order of most at risk to least at risk, so as to ensure that each child has the right to life, survival, and development in accordance with the joint United Nations Agreement on the Rights of a Child, towards seeing that children's best interests are upheld in such a time. What will we do, you may ask? The children's cause will motivate and demand governments to foster joint efforts aimed at capitalizing on national comparative advantages commonly associated with partnerships between governments and private entities such as schools, churches, community groups, and key stakeholders, as we motivate stakeholders to embark with us in this cause, determine what kind of help Caribbean families and the children will need in the time of pandemics, locate and document data on where children and families are most susceptible, create a vulnerability map, and deepen regional integration by means of a single common market and economic union would be key pillars to economic reconstruction. Our mission: to bridge the gap between vulnerable families and equitable opportunities by identifying the disadvantaged, creating equal opportunities for the rights of the child to life, survival, and development through social justice. Our vision: to merge and deepen regional integration by means of a single common market and an economic union that will be used as key pillars of economic reconstruction in a time of crisis. Our focus: Caribbean families and by extension the children that are disadvantaged in the times of pandemic due to a lack of social, emotional, economical, and physical support systems. Our objectives: during a pandemic, the Children's Cause strives to determine what kind of help Caribbean families and the children will need, locate and document data on where children and families are most susceptible, create a vulnerability map, reduce vulnerability amongst women, children, and minority families, promote and motivate stakeholders to collaborate through regional integration by means of a single common economic market and union that would be used to facilitate development.
Our core values includes compassion and collaboration. To support efforts to meet pressing needs, we will both directly use our influence through compassionate acts and pleas and by helping to unleash the power of networks. A cohesive community is something that our children deserve. As such, we are aware that working together to uphold a common commitment to improving the lives of children and their families will ultimately make us stronger. Equity through social advocacy and social policy development to ensure impartiality, fairness, and justice for all. To ensure that everyone in a community has access to the same opportunities and outcomes by considering systematic inequities. Togetherness through unity, embracing our neighbors, regional counterparts in the most interests of human development by treating the vulnerable as we would like to be treated, and advocacy. We commit to take the lead in pushing for greater and equitable access of resources that lay the strongest possible groundwork for all local and regional vulnerable counterparts.
Now that we understand the cause, how exactly is children's development affected during these times? Well, growth and development is a significant process. Despite a pandemic or any crisis for that, we should understand how children develop so as to be able to better meet their needs. Particularly in a pandemic such as the last, children were affected physically as they didn't have opportunities to develop their fine and gross motor skills, play at recess, or go walking to and from school, as children who normally use this time to strengthen or develop their muscle, general body, and brain functions. Children are also affected mentally. Reports suggest that children displayed severe anxiety, depression, alienation, stress, frustration, neglect, and even tension. Comparatively so, before, children would not have been losing focus and their abilities to observe, recall, and imagine because of the conditions that they were faced during the pandemic.
Possible challenges to children's rights and needs being met in a pandemic. Millions of children throughout the world has been devastated by the pandemic. Despite the fact that youngsters are not among the high-risk categories that are directly impacted by COVID-19 in terms of health, particularly mental health, family issues, education, sports, culture and the arts, a lack of social mingling, and socio-economic challenges, this current generation of children will continue to experience the effects of this public health crisis for many years to come. All too frequently, their rights to social security, to the best possible level of health, to life, survival, and growth, as well as to protection from violence, have been compromised. They face serious risks to their livelihood except appropriate action is done. The pandemic of COVID-19 had adversely impacted disadvantaged children. Economic downfalls will continue to harm poorer households and families in poorer nations, and hence children. Children are also affected in the pandemic as over 1.5 billion students were out of school and widespread unemployment and income loss as well as economic uncertainty are anticipated to raise rates of child labor, sexual exploitation, adolescent pregnancy, and child marriage. Family stresses, particularly those living under quarantines and other limits of freedom of movement, may increase the prevalence of domestic violence. As this worldwide mortality toll from COVID-19 rises, a substantial amount of infants will become orphans, leaving them exposed to exploitation and abuse.
What is interagency? It is a collaborative effort among people from diverse companies, generates something through shared efforts, resources, and decision making, and share focuses on enhancing services to children and families. It is also an interaction between policymakers and administrators in charge of handling organizational mandates, funding, management to frontline collaboration among caseworkers, families, mental health professionals, teachers, and others. So why is it important to have interagency collaboration? It is important because stakeholders and community members will view the situation, contribute, develops and implement plans, voice their concern, address directly, create awareness, general understanding the purpose of the content. It also develops networking of collaborators, policy, regulatory framework that lay groundwork for planning, monitoring, evaluating, lay platform for an efficient engagement in discussing to what extent they can work together to assist in the time of crisis.
Statistical officers assist the Ministry of Health and Education to identify families who are most vulnerable so they can get the assistance they need. The church, which is often used as shelters, joined with the Ministry of Health to make healthcare accessible, providing basic necessities along with emotional support.
Religious organizations. There is great value to religious organizations as community partners. They contribute towards well-being and leveling up across communities. During a pandemic, religious organizations are needed to provide emergency social care, physical, mental, emotional, and spiritual well-being, and other benefits to the community. Hospitals. The health sector is required to provide proper medical care and attention to affected family members, as well as educate vulnerable families on preventative measures, cure, and care of the disease. The government. During a pandemic, the government's role is to ensure that vulnerable families' basic needs are met, to supply the different sectors of the economy with necessary assistance to sustain these family members. Additionally, to update and provide necessary information and safety measures to keep family members safe and secure as they battle the pandemic. Statistical officers. So statistical officers are responsible to constantly update vulnerable families on statistics and relevant information regarding the pandemic so that the necessary measures can be taken for their safety and care. Community and social services. Community and social services are responsible to provide moral support, counseling, as well as promote community outreach to raise funds or utilize different mediums to acquire groceries and other necessities.
Collaboration may pose some challenges when venturing into such commitment. The following challenges are associated with having separate agencies. Ineffective communication. The passing and processing of information is critical when exchanging messages. Information can be easily misinterpreted between agencies interfering with joint ventures. Ineffective communication leads to unsolved issues and a lack of cooperation. Differentiation of leading styles. Some agencies use informal methods whereas others use formal managerial styles. This can lead to disputes among agencies where the educational institution may have to continuously change or quarrel for cooperation. This is a setback from effective growth and support within the schools. Funding. Agencies may be expected to fund various projects and fundraising events. Disagreements arise based on the suggested budget, causing conflict. The suggested budget may be too high with limited resources, or they may be in disagreement with a specific task given. Keminas also stated that another issue may appear due to general lack of funding within the company and they are unable to cover expenses.
Now that we understand the challenges of the region, we understand how children will be affected. We understand children's rights and challenges, the benefits of interagency relationships, and challenges with having separate agencies. We hope you understand that reducing vulnerability in this new paradigm will call for a fundamental change from traditional techniques and solutions. The most vulnerable areas in terms of production, housing, healthcare, education, and access to food and water supplies will be first identified in a detailed examination of the community before a suggested course of risk reduction measure be offered. The plan would make use of environmental management tools, contingency plans, and development policy instruments, and would incorporate risk management into instructional framework for all regional governing departments. This will be done in phases through spreading an awareness that children are inevitably affected by their families' circumstances, and as such, their basic rights are endangered if not addressed. Bringing separate entities or joint services under one umbrella for a more concentrated approach to locating those families and identifying their needs. Unitedly, create a system based on statistics, information from schools and communities, and inevitably a rating system to determine most affected in each of the social domains. Encouraging stakeholders to pool their resources towards creating a fund for such a time, and to also strategically deploy their services towards most vulnerable to least vulnerable, and also acquire corporate sponsors. Chartering food soldiers, pooling resources from religious entities, schools, and communities. As I close, in the words of Indira Gandhi, I urge you to join our team as we must protect families. We must protect children. We have inalienable rights and should be loved and should be taken care of physically and mentally, and should not be brought into the world only to suffer. There are families that need help. There are children that ought to be protected. Would you join the children's rights cause today?